Welcome to Dogtors Without Borders, the podcast that takes you beyond the clinic and into the many ways veterinarians and the professionals who work alongside them help keep animals and people healthy. I'm your host, Kristen Lehrer, and today we're diving into the essential and often under-recognized role of veterinary nurses. Joining me are two incredible guests, Taylor Epp, our Assistant Dean of Veterinary Nursing at the MSU College of Veterinary Medicine, and Maggie Bodiya, a licensed veterinary technician at the Veterinary Medical Center, who specializes in anesthesia and analgesia. Taylor, Maggie, welcome to the podcast.
Thank you.
Hey, thanks for having us.
So to get us started, tell us what a veterinary nurse is.
Yeah, so veterinary nurse, or also referred to as veterinary technician, is a highly skilled, trained professional who plays a critical role in your animal's health care. We assist from everything from patient care, diagnostics, to anesthesia, client education. You can think of them as an equivalent to a nurse in human health care. Today, Maggie is our special guest, and we're thrilled to have her with us. She is a veterinary technician, but is a veterinary technician specialist as well in the focus area of anesthesia and analgesia. So we're going to have her share some insights into her unique role and some of the challenges that go along with it. So Maggie, can you share with us a little bit about your journey in veterinary medicine and how you sort of were inspired to become a veterinary technician?
So, from a young age, I'd say I had this undeniable kind of love and devotion for all living creatures. Me and my best friend would bike around the neighborhood. We were the turtle brigade that used to help turtles cross the road to their water source. I would nurse baby birds at my barn. I always had dogs growing up. So I just have really always had a love for animals. And as I went through schooling, I really loved and excelled in science and math. I really enjoyed those subjects. And so when I was trying to think about a career path, veterinary medicine was kind of the first thing to come to my mind. But really the first thought is usually to become a veterinarian, right? That's kind of everybody's first thought when they're just considering. And it wasn't until I took VM 101 at MSU that I really learned that there was this other role in this team, which was a licensed veterinary technician. And so once I realized kind of what that role does, that they really are, the ones that are immersed with the patient care, they get to know those animals, they advocate for them. And certainly the vet does that as well. But the ones to be working with their hands on the patient, I knew from that point on that was actually the role that better suited me and that I wanted to do. So yeah, as far as my journey here, I went to the veterinary technician program here at MSU and graduated with my bachelor's. I went on to work in kind of a general practice for about a year. I worked in specialty after that in a surgery department, and then realized that I had this kind of love for anesthesia. And so when MSU had an opening, I jumped at the chance, and I've been here ever since. So
that's awesome.
Yeah.
I'm going to go back for 1 second on one thing that you said. So, everybody sort of thinks of the veterinarian first. When you're a little kid, if you like animals, people say, oh, you want to be a veterinarian. And it's very common that people don't know about the other important players that are part of that team. And team-based healthcare is kind of the gold standard now in human medicine and veterinary medicine. And so there is this seamless collaboration between the veterinarians and the technicians and nurses and the assistants and support staff and even the clients to sort of maximize that patient's care and be sure we're advocating for that animal. And so here at Michigan State, we have the program that Maggie graduated from. And we have also in the teaching hospital, the working title for our veterinary technicians is veterinary nurse. And that is really been very helpful in helping the clients understand who is helping with their animals' health care and what role they're playing in their animals' health care. And then We also have updated the name of our program from the veterinary technology program to the veterinary nursing program to also help with that perception and that understanding of what these individuals are going to be doing in that healthcare team. So that's great.
Yeah, and obviously, you know, it's there are a lot of things that are very different from human medicine, but I think that's the easiest way for people to understand because there are so many similarities in human nursing. So it's really been helpful, like you said, in you know, the public's viewpoint of what we do and who we are.
Yeah. So what led you to specialize, and then what specifically led you to like anesthesia as the place that you wanted to specialize?
Yeah, so I've always kind of been the type of person to want to continually torture myself with education. And so when I went through the program here, I really loved anesthesia as a class. I loved the rotation in our clerkships. And so I think the reason I sort of chose anesthesia was there's a really wide range of patients that you're going to see. You're going to work with patients who are healthy, you know, going under anesthesia for very elective procedures, all the way to your unstable, very critical emergencies. And I really like that scope of practice. And so, yeah, when I worked in a surgery department, we had to kind of tackle both the OR, you know, assisting and the anesthesia. And I really felt like going to a place where I would work solely in anesthesia would just help my knowledge, really elevate, you know, the gold standard of care. And so, as I said, when MSU had an opening and it was strictly in anesthesia, I knew that was where I wanted to go, and kind of moving up the ladder there just kind of made sense to do the specialization.
So are you a little bit of an adrenaline junkie? Because
I
personally would shy away from all of those scenarios. So
absolutely. I have swam with sharks. I have jumped out of a plane.
Yeah.
I do love the rush. Yes. Yes. I like the mix, right? So I don't think I could do that all the time, but it's nice to have a really wide range of those types of things. Yeah.
So there are several VTS specialties that exist. Anesthesia isn't the only one. And we have several specialists in our teaching hospital here. Can you give us an idea of what the process was for you to become credentialed?
Sure. Yeah, it was quite a process. So kind of first you have to go through a pre-application process. And this is just sort of verifying all the requirements that you need to have. For example, you have to have a certain amount of hours that you've been licensed, that you've been working in a practice, and that practice has to be credentialed and verified, those employment hours, things like that. And then you have to have a certain amount of hours within that specialty. So I had to have so many hours of strictly performing anesthetic care to just prove that I had the experience under my belt to kind of start this endeavor and that I would be qualified for it. And some other logistical things like that, you know, proof that you were licensed and things like that. You have to have kind of a letter of agreement that you are working with diplomats. So what a diplomat is a boarded DVM, so boarded doctor, or another licensed vet tech that was specialist. So you had to work with one of those two to really get this accomplished. And so once you have your pre-application accepted, they say, okay, check, you can go on with your application process. For anesthesia, and most of them, you have about a year of a timeline to compile the application. And so the application consists of like 60 case logs. Each of those had different requirements of skills that had to be proven within them. I had to write 4 really in-depth case reports. So describing everything that I considered, every point of care that I had given to that patient from the time I met them all the way through recovery, and really dive deep into what I, had to do for those patients. You have to have a skills list that they provide that you've kind of proven your mastery of a certain amount of skills. Those have to be signed off by that diplomat that I mentioned. You have to have a certain amount of continuing education hours. They're very specific on what types of continuing ed will suffice. You have to have letters of recommendation. You write a statement of purpose, just kind of explaining why you want to do this, how you might contribute to the profession afterwards, things like that. And so that's the application process. And again, you compile that over about a year's time. You submit that and you press the scary button and you press send and you wait to hear back. And if they approve of that application, then lucky you can now take the board exam. So again, every specialty is a little different, but for me, I had about, I think 6 maybe months or so to study. And then I would go to a big conference and I would take and sit for that board exam. It was a 2-day board exam, 2 parts. Pretty giant exam. And then you again wait for those results and hope that you pass, and then you can get those letters. So
how long between when you completed the board exam did you get the results?
It felt like 10 years. I want to say it was about 4 or 5 months.
How did those results come in?
I know the exact moment that it came in. It was via email, and I was at a friend's house watching a movie, actually a bunch of coworkers, and I think I just stood up and said, I have to go home. And I left, and they were all concerned because I had no explanation, and I drove home so that I could be at my house when I opened the email. And then I did get the acceptance, and I think I just cried, and it was a good feeling. But I knew I had to be alone. I knew I couldn't be in front of a bunch of people had it gone the other way. But yeah.
Who was your mentor going through this process?
I was so fortunate, and I had a anesthesiologist named Dr. Sheila Robertson, and she was an absolute godsend when she was here working with us. I learned so much from her. I would actually spend nights at her house. She'd make dinner, and we would study together and work on things together. And so I attribute a lot of my success in that process to her.
So this was all in addition to your credentialing to become a licensed veterinary technician.
Correct. So yes, this is once you've become a licensed vet nurse or technician. Yep.
So for credentialing, just for everyone to know, for credentialing for a technician, applicants have to have graduated from an AVMA accredited program, so the American Veterinary Medical Association accredited program. They take our national exam board or national examination test, and then in some states they also have additional state boards that they have to take as well. So Maggie did all of this in addition to her already strenuous credentialing.
Yeah, like I said, I somehow enjoy the torture. Don't know.
What advice would you give for anybody interested in pursuing this specialization?
Yeah, I have a lot. I would say that it's probably important to make sure that it is a time in your life that you have the bandwidth to really dedicate to this process. And so that's going to look different for everybody, but if you feel like you can kind of take on this task in addition to your normal job, right, because I'm still working 40 hours a week plus through this, that's the biggest thing. So it can be overwhelming. I would say to set yourself up for success, you want to be very organized. And so even before you even think about it, while you're obtaining your hours, right, maybe practicing some of these things is helpful. Finding a mentor who could help you through this is helpful. The instructions for the application process is so detailed. So being organized, taking the time to kind of make timelines for yourself to make sure you're staying on task. Those are things I would say. But the biggest one is just to make sure you can really dedicate that time. If it's a busy year for you and you have things going on in your life, maybe push it to the next year.
Yeah.
Yeah, that's what I'd say.
So you talked about some of the skills checklists that you had to have and, different knowledge bases that you had to have that were sort of required for this accreditation. Give us an example or some examples of like what some of those advanced skills might be.
Yeah, so it can be difficult to do this specialty if you work in a general practice, I would say, because you're not routinely performing a lot of these procedures that would require those advanced skills.
Right.
So some things that come to my mind are placing arterial catheters. That's not something that a general practice is going to be doing for an anesthetic case. And so that is really advanced blood pressure monitoring. Takes a lot of skill and time and practice to kind of master that. So that's an example of one. We will, use pretty advanced monitoring systems, and then having more than a baseline knowledge is just something you're going to acquire over that time working with a specialist, working under an anesthesiologist or another specialist. And those things are going to just help you really see the whole picture of your patient and just take care and just elevate the understanding of what's happening with that patient under anesthesia.
Yeah. And so working here in a referral clinic that's a teaching hospital, I imagine you have some pretty complex or like high risk conditions with a lot of your patients. So how do you go about like doing the anesthetic planning for cases that are so complex like that?
Yeah, I think that's one of my favorite parts, really. So sometimes you can take your time and really go through that patient's history and think things through. And other times, because those emergencies come kind of on the fly, you really got to have a system, right? Like a systematic approach to making a plan for that patient. And so, as you do more, you get better and faster and more efficient. But taking that patient's history into account, it's really easy to get one-track minded. And so the cool thing about the anesthetist is that we really have to take in all components of that patient. We have to look at things that we might think aren't actually related to that surgery and make sure that we are paying attention to them.
Yeah.
Because we are just, caring for whole body, even though the surgery or the complication might be with one body system. We have to look at the whole picture.
So like an animal that's also a diabetic or also has kidney disease.
Exactly. Even down to the geriatric patient that has arthritis, right? I'm going to be manipulating this patient under anesthesia, and I need to know those things to make sure that I'm keeping that animal as comfortable as I can.
Yeah.
So yeah, it's a kind of a whole picture approach, looking at their history, looking at their blood work, looking at their demeanor, doing a physical exam on them myself, and then coming up with a plan based on the drugs that we have here and what their procedure is going to entail.
Yeah. So your specialty is anesthesia and analgesia, and analgesia is pain management. Mm-hmm. And so how does that factor in? It's a critical aspect of our patient care, and how do you assess and address pain in our veterinary patients?
So just like in human medicine, we really follow in their footsteps, honestly, and they have gotten better and better at pain scoring, objectively understanding pain levels in people. And so we kind of follow suit with our own pain scales. There are a few that are out there that are, they are verified and studied to be effective. And so we follow those. And they're going to look different in animals, obviously, versus people. And so we have pain scoring systems that, assess these patients from the second you look at them to how they move to their vital signs and things like that. And that's the detective part of this job, right? You can ask a person, what's your pain level on a scale of 1 to 10? Even that, I never know what to say. I'm like, 2? I don't know.
Is my 7 the same as your 7?
Correct.
Yeah.
So it's tough. It's really subjective, yeah. And so what is cool about our assessment is they can't tell us, but they do tell us, right? If we watch their behavior, if we understand those nuances, we can actually look at a patient, look at their facial expressions, look at what their ears are doing, how is their body postured. Like I said, what are their vital signs? We put those together in a pain score, and we can actually quantify their pain. And it's a really important tool that we use because, again, pain is so subjective. Pain is what you say it is. And because our patients can't talk to us, we have to have a way to really monitor that, assess that, and then intervene as necessary.
What do you think, in your opinion, is the biggest misconception about anesthesia in veterinary medicine?
I guess I would say that maybe not a misconception, but something that I think is often kind of overlooked. And it's because they can't talk to us, right? A lot of these animals are so stoic.
Right.
And more stoic than we are.
Right.
I have seen a golden retriever, and that is a example I will use because I'm obsessed with that breed, but you will see a golden retriever coming in with a broken leg, dangling off its body, but wagging his tail.
Right.
And
happy to see everybody.
Happy to see you, gives you kisses, right? And so, you look at that dog and you look at its face and you think, that dog's fine. But that dog has to be in some degree of pain, right? Their leg is broken. And so these animals are amazingly stoic, and maybe a misconception is that, they aren't painful when they really are. They're incredible animals who just show it differently. Yeah.
Yeah. And I mean, so even in our classes, we both teach the veterinary nursing students, and that's a big part of it is recognizing normal, recognizing abnormal, and treating each animal separately. What's normal for this animal? Maybe they really are happy-go-lucky, and them being quiet and secluded is a symbol of some pain. Yes. Or it's the opposite. Normally they're pretty, happy to be on their own, laying in the sun, but now they're really needy and coming up to us a lot, and they're trying to communicate with us. And so that's their symbol for pain. So it's really patient by patient also.
Yeah, I mean, I love that you said that. I feel that I tell my students all the time, when you go into a hospital and something's going on with you, you would expect and want your treatment plan to be very individualized to you, right? Because you are special and unique person,
right?
And these animals are too. And so it's really important to treat these animals in that same way, that we look at their story as a whole, as an individual, and really just cater to that specific patient. Because like you said, demeanor is going to be different, right? What is their normal? We have to get the client or the owner involved in that conversation too, because we don't know how they are at home, right? So yeah, it's really a puzzle.
How do you collaborate with the veterinarians, the diplomats that you work with, and even the clients, to ensure patient safety and comfort for these different procedures?
So I think as far as the clients go, getting that thorough history and really asking the questions that matter and that are going to matter to them, right? And they're entrusting us with their babies, and they hand them over to us, and they give us those little details that maybe they don't feel are important, but they are. And as far as the diplomats, they're really making sure that everything we think about has been addressed, right? So every aspect of that patient's care is accounted for. And so, as far as our collaboration, it's going to look different in every hospital and every setting, but we are the ones who basically carry out the anesthetic care and the treatment that we've decided as a group. And it's a very collective effort. It's even within different departments, right? So if a patient comes into us and maybe has a heart murmur, the first question I'm going to ask is, have they been seen by our cardio team? And if they have, then maybe I go talk to the cardio team, or I look at their records, right? Make sure I understand completely what their cardiac issues are, so that I can make sure that I talk to my team and we collaborate and make sure that we are taking care of that patient as much as we need to, even if their procedure has nothing to do with their heart, right?
Yeah, right.
We're still going to be changing how that patient, works under anesthesia. So it's important to know.
So how does a really well executed anesthetic plan contribute to a patient's recovery?
It's everything. I mean, I think that there's different phases of the anesthetic process, right? And so we are really fear-free here, and I know more practices are starting to kind of use that approach.
Can you explain to me what you mean by fear-free?
Yeah, good question. So when we think of the approaches that we take to handling animals, there is a kind of set of different devices and different approaches that we can use to make that experience very positive for that patient. And again, because we can't talk to them and tell them, hey, this is what we're going to be doing today, or helping them through kind of coping with the stress, there are ways that we can manage the stress of those patients. So we look at their levels of fear, anxiety, and stress. We call that an FAS score. And so we'll use different tools to assess how stressed, how fearful is this patient, and what can we do to decrease that? Because we know that, science tells us that the level of fear and anxiety and stress that they have makes a huge impact on the outcomes. And so if we can decrease that, make things as positive as we can of an experience for them, they will have a much better outcome. And so these practices are being integrated into more and more hospitals and more veterinary settings. It's a certificate that you can get. There's different levels of fear-free certification. And so if the nurses and doctors in your practice go through that training, you can be certified. And then it kind of gives these clients, they know that you are going to treat their animal in a certain way, right? And to make sure that they're minimizing their stress as much as possible.
Always having that positive experience.
Yeah.
Well, our students do fear-free training when they're in our program, and then they can continue on up the levels of certification when they're here in the hospital. And most of our nurses here in the hospital are fear-free certified.
Everything from how we handle them and how we introduce that patient, how we talk to them in the beginning, what drugs we give them, all the way up until they open their little eyes afterwards, right? And yeah, so I think that, I forget your question, but I think that, yeah, I mean, the outcomes for anesthesia and how they do in recovery have everything to do with the planning that goes into it. And again, sometimes you have time to plan and sometimes you got to be on the fly. And that's why this elevation of care is so important, because we can make those decisions very quickly and in the moment because we have to.
Yeah. Can you remember like a specific case or a story where your expertise made a significant difference in the patient's outcome?
Well, I mean, yes, there are many that come to my mind, I think, but one that really stands out to me is probably one of the craziest cases I've been a part of. We had a dog who, I think it was a Labrador type dog, who had a gunshot wound, unfortunately, and because it was a buckshot, right? It's the right word. It hit many
Spread.
You got it, exactly. So unfortunately, many vital organs were traumatized by this gunshot wound. This dog was extremely unstable. We took it to surgery, and it was the first time in my career that I had a patient on the table with both open abdomen and an open chest cavity at the same time. Two surgeons working on both cavities, which, again, I had never seen or done before. And so, I mean, I think we took out many an organ or partial organ in that animal. We did a nephrectomy, so we took out the kidney. We did a liver lobectomy. We took out its spleen. We had to take part of its stomach. So just, the buckshot just scatters. And so many of these organs are just, are affected. And in the chest, we had to do a lung lobectomy, and we had to do a diaphragmatic hernia repair. And so really, I mean, from head to toe, this dog was affected.
So that dog's chest was cracked open. You had it on a ventilator, so breathing for the patient, plus the abdomen was open, removing organs. I'm sure there was blood products being given and blood pressure monitoring that was occurring.
Yes, when we have an IV pole that is just filled to the max with syringe pumps and all these different things, we call it, well, there's a couple people have different names. I call it the tree of life, to be a little more optimistic. Yeah, and so we just throw everything we can at this animal. The dog did make it out of surgery. I don't believe he made it out of the hospital, but that was a very memorable case that I hope that at least had a fighting chance, just because I had, this level of knowledge. But I also, again, have these anesthesiologists behind me that are, so amazing. And working together, we did the best we could for that dog, and it's a sad outcome. And unfortunately, it's something we have to kind of learn to work through, but a challenging case indeed.
So I'm sure your specialized skills and knowledge have afforded you opportunities that you wouldn't have been able to take advantage of as a technician practicing in general practice. Do you have any cool cases that you've gotten to work on here in the teaching hospital? Yeah,
so a couple things that come to mind. It's a teaching hospital, so we have interns and residents, and we have lots of people who are interested in the really cool cases. But I did get the opportunity to work on some cases that I probably otherwise wouldn't, because I was going for the specialty. So we have traveled to different zoos, or sometimes zoo animals will come to us, but probably a highlight of my career is being able to help anesthetize a lion at a zoo out of state.
Wow.
Yeah, and again, just probably highlight of my life career.
How do you anesthetize a lion?
Yeah, there's a lot of similarities, honestly, and a lot of differences, as you can imagine. But the kind of capturing the animal and darting them, not something that I did.
Right.
But once that animal was anesthetized, then we kind of go in and we intubate it. And, the tube size for a trachea for a lion is similar to a horse.
Wow.
So, which I've used before. So, we intubate. We had to transport to a facility at the zoo to do the actual surgery. So that was a little scary, being trapped in the back of a van with a lion.
No way.
And a small anesthetic machine. I remember asking, how do I get this door open if I need to escape quickly? And so that was, again, adrenaline inducing. Yeah, he did awesome, and recovery was cool. And obviously, there was a huge team supporting this lion, but that was definitely an opportunity that I feel that I got just because I was going through this process. And yeah, I mean, it absolutely has opened other doors for me, and that's one of the reasons that I wanted to pursue it. I have had the opportunity to speak at, regional conferences, and that has been a great experience for me, something that I've always wanted to do. I have kind of joined a group that I used to go around and do equine anesthesia labs kind of around the country. So I would go to different equine facilities with a team of people, and we would have nurses gather, and we would all do wet labs and different things, just helping them elevate their care of equine anesthesia. And so, again, these opportunities I don't believe I would have been able to have without this. Sometimes another university will need basically a sub for their anesthetic team. So I've locumed at a few places, and so that's been an awesome experience to go to other universities, see how they do things. And I think they just have this understanding that I have this level of knowledge and skills, and so they kind of have this trust in me a little bit. And so, which is a really cool feeling. I can go, I can learn from them, maybe they can learn from me, and I can help them out in the process. So those types of things are, I feel really fortunate to have been able to do, because of this.
And so in order to keep your specialty, do you have certain requirements that you have to complete?
Yes. So every 5 years we have to certify. And it's, a little bit of a mini application, if you will. So it's mostly based on continuing education hours that we've accumulated in that time to make sure we're keeping up with the knowledge and skills and proving those CE hours. That's the most of it. And then ensuring that you're still credentialed, all those types of things. But every 5 years you have to recertify. So it's good because you just make sure that you're keeping up. Medicine changes every day. And so, it forces you to really make sure you're on your stuff.
Yeah. What, in the time that you've been a part of veterinary medicine, what advancements have you seen in the anesthesia world?
I think the local and regional anesthesia has probably been the biggest advance. And again, we follow humans. And so I think it's because partly, opioid crisis and things like that, we're really moving to different modalities of how to, cover pain in these patients. And so the advancement of using ultrasound guided nerve blocks and things like that has been huge. And I feel very fortunate here that we have really skilled anesthesiologists to do those types of things. And you can avoid a lot of the negative side effects that come with all the other drugs that we would need to give if we had not done that. And really, if you're going to go to the hospital, you're going to get a surgery, you will almost 100% be getting some local or regional block, and that's going to last for a few days. Right. When it wears off, right? And so that's something that is just getting more common in veterinary medicine, and it's really exciting to see because I can't think of one procedure where there's not some type of local block that we can do to help that patient, not appreciate the pain that they otherwise would. Right. Yeah.
And being able to block the pain there locally, then maybe not having to use so many systemic pain medications. Exactly. Like opioids and things like that.
Yeah, and we don't always have access to those types of drugs, but the local and regional blocks that we have are almost always available. And so, again, a lot less negative side effects. They can still have their normal, kind of attitudes and mentation. They're not depressed from the other drugs. Those side effects, it's awesome. So that's probably one thing I would say I know is going to continue to keep improving, and more places are going to be trained and that sort of thing.
What do you think is maybe the most surprising or unexpected lesson that you've learned in your career?
I'm going to think about that for a second. I guess I would say, I was just talking to someone recently, but just to never give up on a patient. I think that so often, especially at a referral hospital, we see kind of the sickest of the sick. We see the most critical and really traumatizing things. And there are times when I've thought to myself, there's no way this patient's going to survive. Right. Or there's just no way, right? All the odds are working against us. This is a terrible situation, very, sad and upsetting. And sometimes just to keep going with that patient and not give up on that patient, they walk out of the hospital. And even if you were sure they weren't going to, right? Because we see so many things that are tough to deal with, but just to not give up on these patients, because you just never know. There are patients that have defeated all kinds of odds because of our care, and they obviously wouldn't have had we said, this is too bad, this is too traumatic, this is too critical. And so I have learned to, really give every patient a fighting chance.
Yeah. We talked a little bit about some of the qualities a person might need who wanted to specialize in anesthesia. Maybe a love for the adrenaline hit is one of them. What are some resources or organizations that you would recommend for someone who's interested in exploring this specialty?
So the AVTAA, or the Academy of Veterinary Technicians in Anesthesia and Analgesia. They have a website that has all the information that you could ever need about how to get started, what's required, things like that. And every different specialty is going to have that. So truly, if you Google each of those, you'll come up with, the boards for those specialties, and they should have all the information or contact information to kind of get you started.
And you here in this teaching hospital, you have a whole team of veterinary technicians that are every day just working in the anesthesia service. Not all of them are specialized, but some of them have moved on to get their specialty. So do you feel like you being specialized has helped to foster other individuals to want to become specialized as well?
Absolutely. I do think that while we, generally have the same job, right? It's to care for these patients from beginning to end of their anesthetic need. I think that every hospital will look a little bit different, but the nurses who are specialized may have a bigger role in training new nurses, which I think is great, because it's just kind of, again, snowballing the effect, and kind of gets them inspired, hopefully, to do the same. I think that they might be the ones who are doing the more critical cases, and again, coaching students or other nurses or things in those roles, which is really kind of different but exciting. And I think that we're all, we all have this love of what we do, but there are certain cases that I love to do that another nurse probably doesn't love to do. Mm-hmm. And so we all kind of play our part, in that team effort.
Yeah.
So the anesthesia service here at Michigan State is one of the services that crosses on both sides of the hospital. So you are handling cases on the small animal side with dogs and cats and other small animals, but you also are going to work with horses and livestock and ruminants. What is the difference between those two?
Complete difference. But I'm glad you asked. Really, that's another aspect of anesthesia that I love, and I'm so happy that I get to be a part of both sides of the hospital. And so, working with these large animals, horses, cows, it definitely takes a different approach. They have a completely different demeanor. They have a different mindset. The drugs might be different that we use. Their anatomy is completely different, right? So there's a ton to consider when we are handling and anesthetizing these patients. Again, like you mentioned, but we also do ruminants, so sheep and goats. We do pigs. So it kind of, it really opens up and expands the range of species. And that's why I think a lot of us are just in vet med so proud, because we have to care for all species, right? And they all are so different. And, in those animals, safety is a little bit more of a, precaution. I will definitely handle a dog much differently than I would a 2,000-pound horse because of the sheer size and risk that goes into it. There definitely is a high risk working with those patients. And so you have to be really knowledgeable in their behavior and how to handle them safely so that they're safe, we are safe, the team stays safe. Different world, but it's so fun.
If you could go back in time, is there any advice that you would give your younger self starting out in veterinary medicine?
Oh, and vet med in general. Little Maggie, what would I say to her?
Little Turtle Brigade, Maggie.
I would say that it is a really tough job. it is a little harder than I guess I thought it might be. And I think that's because we have this love and passion for them, right?
Yeah.
It's very easy, and understandably so, to get attached to these patients very quickly.
Yeah.
Doesn't take much.
Right.
And so I think that the loss and the euthanasia aspect of our job and just some of the trauma that we kind of go through, I think is the part that I didn't quite understand, and you wouldn't understand until you fully go through it, right?
Right.
But that's something that, again, makes our profession very unique. And I think that the level of like passion and love that we have for these guys is the reason why it's so
Right.
that it can be really tough, right? So it is a awesome field. I would tell my younger self to do it all over again, but just to go easy on herself a little,
Yeah.
as it can be hard on the heart a little bit. But we're getting better at dealing with those things, and all in all, the impact I know that I've made on patients and, you know, their owners' lives, and all of us do, is something that I'm really proud of and would definitely,
Yeah.
yeah.
You're making a difference every day.
Oh.
So what do you think the public should know about the role of veterinary technicians and specialists in animal health care?
I would say to them that we got into this field because of our love for their animals. And although situations can be challenging and difficult, I do want them to know that we are treating their animal as if it's our own.
Right.
If they could see the way that we handle those animals, and in our downtime, we sit in their cages and pet them. I think it's so hard for owners to leave. You
Right.
know, they don't really get a chance to be with their animals like you might be with a child. And so to trust that we have this love for their animals like they're our own, I want them to know that.
Yeah.
That we are snuggling those patients, that we are like giving them all the love that we can. I want them to know that. I would say also that as the nurse, we are really highly skilled, and we take our job really seriously. And so we know that this animal is a family member to them, and you know that we have this level of training and that we are an integral part of that. And you know, if you think again, I always kind of relate back to my experiences in human medicine when I go to the doctor. But you know, if you're staying there, the nurse is the one who's taking care of you.
Right.
You know, they're the ones who are bonding with you, talking with you.
Right.
And so it's the same thing for the nurses and the specialists. They are, you know, talking to your animals in the way that they know how.
They're the ones that are cage side instead of bedside.
You got it.
With your animal.
Yeah.
Yeah.
What are issues facing the veterinary nursing profession that you're combating now?
Yeah, I would say in general, veterinary medicine right now is really sort of waking up to the team-based veterinary healthcare model, and that has been sort of gold standard in human medicine, and that's now, you know, becoming more prevalent in veterinary medicine. And so really for us, it's ensuring that our graduates are utilized to the fullest capacity and really recognized for the skills and the knowledge that they have, and that role, that important role that they play in that team. You know, as oftentimes we are the ones that are that advocate between the patient to the doctor, or that, you know, collaborator between the client and the doctor.
You mentioned that it was intimidating coming back to work here in the program because you were working with former teachers. Many of your students will come back and work with you. How have you made changes to lessen that intimidation for them?
Yeah, that's a good question. I think it's sort of a like camaraderie, right? We are all here for the same reason. We all are here for the animals. We're very compassionate and passionate individuals, and we're all working towards that same goal. And so I think at the core, everybody is able to sort of realize we're here for the animals. And you sort of get over that intimidation but it was absolutely intimidating to come back and work with the people who instructed me. We have a lot of graduates who graduate and they start working directly in the teaching hospital. And so, yeah, your role shifts a little bit, or shifts a lot from being that student to now being on the other side of that relationship.
Yeah, and it's very cool to see the growth, right? So working on the floor, I've now seen these students from when they were in their didactic courses, they're scared, they've never touched a syringe and needle before, to watching them grow into this nurse who is competent and confident, and they have these light bulb moments and they're doing it, and to see them and be side by side with them, it's pretty awesome experience.
Yeah, that's the best part of this job, is watching the students, nail those moments and have those aha moments and, do their little dances after they've completed a skill.
Yeah.
Where do you hope the profession is a year from now?
I do hope that we continue to, like you said, really utilize these nurses for the skills that they have. Sometimes I do think that there are lots of ways that we can be efficient as a team if we just remember that the nurses have these expertise and these certain skills, and that can help and allow the doctor to do more of what they need to do. And so, yeah, I hope that we continue to work towards that and to maximize, what these nurses are doing.
Yeah, and I think too that in each state, we're a little different. So sometimes our credentialing is different. Sometimes our scope of practice is a little different. And so working to have this standardized practice model in every single state, so that practices understand this is how I utilize my veterinary technician to their maximum capacity. I hope that, and I do see that that trend is there, that is a national conversation that's happening. And so I hope that within a year, we've seen some progress, that some states have made some changes to help with that in each of their states.
That's all for today's episode of Dogtors Without Borders. A huge thank you to Taylor Epp and Maggie Bodiya for sharing their insights and experiences in veterinary nursing. If you enjoyed this conversation, be sure to follow Dogtors Without Borders wherever you get your podcasts. And don't forget to join us next month for another conversation with veterinary professionals making an impact in the field. Thanks for listening. We'll see you soon.